Hello, my name is Dr. Kashif Abdullah, and I am a physician here in San Jose, California. And I'm here to speak to you about colds, flus, and pneumonias. What brings about a cold or a flu is usually when a virus overcomes two of our major defenses in our nasal passages. Those defenses are globulate cells that secrete mucus and the cilia cells that help move those mucus out. So, usually in dry, cold air in winter, what happens is at times the mucus can become thick, and it's harder for that cilia to move that kind of stuff out. And you have more contact, and also you're in closer contact with other people that can spread other viruses to you, the cold virus or the flu virus to you. So, usually you get these colds or flus and pneumonia also by touching contaminated objects or being in contact with someone who has recently sneezed in your path or even breathing. And um, symptoms of a cold. So I'll start with a cold. A cold starts with symptoms that begin 1 to 2 days after viral contact, and that after 1 to 2 days, you begin to have a scratchy, tickling, sore throat. So sore throat is the first thing you usually feel with a cold. Then the nasal symptoms begin, and that usually is by the third day, and also run maybe before the third day. But by the third day, the sore throat should also improve. That's another thing I want to mention. But the nasal symptoms will begin with a thin discharge, and then will begin to start getting thick. And what will happen is you will then start to block your nasal passages, and that's the stuffy nose. Around the fifth day, you start having coughs. Um, and subsequently thereafter, maybe the seventh day after the contact, hopefully you begin to start feeling better. So the nasal discharge begins to diminish, the coughing starts to go lower, and slowly by slowly you get better. So the common cold takes some time, maybe about a week, maybe about 10 days for it to go through the entire course. Influenza is different in the fact that it is also started by a virus, but it's much more abrupt. It's a quick kind of thing. Whereas cold took a couple of days to ramp up, flu in the morning you're fine. By the afternoon you're feeling very ill. You also have a sore throat and a nasal discharge, but you start to now having headaches and fevers. And the biggest difference between the two also is you feel tired and you're in pain, muscle aches. So flu really knocks you out, as opposed to a cold is sort of a nagging symptom more than anything else. And uh, something even worse than flu is then pneumonia, and that's when you get fluid or an infection in your lungs. Or pneumonia is essentially fluid in your lungs, essentially. And we determine that by a chest X-ray. We listen to your lungs with the stethoscope, and if we hear crackles or we hear some kind of odd sound in your lungs, we can send you out for a chest X-ray just for determination. Um, and usually, with pneumonia, again, you have shortness of breath because of the lungs being full of fluid at the bottom of the lungs. You can feel chills, high fevers, sweats, cough, and cough is usually you cough up yellow mucus stuff. So this actually needs to be treated sometimes with antibiotics. So this is a much more severe uh, continuation of the symptoms. So, but how do you avoid all this? So the best thing to do is you vaccinate yourself. Vaccinate yourself against the flu. There is no vaccine for the common cold, but there is vaccines for flu. So you should vaccinate yourself for the flu every year. And another thing is frequent hand washing and washing with soap. You should wash with soap for at least 20 seconds anytime during cold and flu season, and you know you are concerned about maybe touching things or what have you, but frequent hand washing with soap. Also, try to avoid touching your nose, eyes, or mouth during cold and flu season. Try to avoid that. That's not easy, but you gotta try. Stopping smoking, and of course, if you're gonna sneeze, try to sneeze in your armholes at your elbow, not into your hands or into a tissue. And maybe the best thing is if you're sick, stay away from people. Stay home. Don't go out. You gotta stay home. That's very important to help prevent the spread of it getting to other people, especially coworkers or at your family members. Try to stay away, maybe stay in your own room during this time of you have a cold or a flu. And treatments, how do you treat this? Well, for the cold and the flu, usually it's just resting, drinking lots of fluid, and if you want, you have a fever, feeling bad, you can take some Tylenol. For pneumonia, you'll need antibiotics. But the best method here is prevention with hand washing, sneezing into your arms, or sorry, into your elbows, and trying to not touch your hands, and trying to not to touch your mouth with your hands or eyes or nose, and staying at home. All right, this is Dr. Abdullah signing out. Thank you very much. Bye bye.